Hi friends, Namaste. I'm Dr. Manjula S, consultant obstetrician and gynaecologist working at Motherhood Hospital, HRBR Layout, Bangalore. In this video segment of patient information, I'll be talking to you everything about amniotic fluid, the water that is surrounding the baby. I'll be doing it in 3 segments. The first segment in which I'll be telling everything about the normal amniotic fluid. The second segment where there is a reduced amniotic fluid, what we call it as an oligohydramnios. And then the third video where we'll be talking about the excessive fluid around the baby, what we call it as a polyhydramnios. So coming to the first segment of this video. So the amniotic fluid, what exactly is it? What are the factors that leads to a formation of amniotic fluid? And then what is the normal amniotic fluid? To make you understand what exactly is amniotic fluid, you can think of a good quality balloon and a fluid filled in it and the baby floating inside it. So the water that you see is nothing but the amniotic fluid. Similarly, inside a mother's womb, there will be a baby completely floating into a fluid around that, the water surrounding the baby, what we call it as a amniotic fluid or also called as a liquor. So this is pretty much essential for the baby's normal growth as well as development, which I'll be telling you how essential is it in the successive segment. So coming to the functions of amniotic fluid, it basically acts as a shock absorber and thus prevent the external trauma to the maternal abdomen to be transmitted to the fetus. It in fact gives the cushion to the umbilical cord, which prevents it from getting it compressed between the fetus in the center and then the uterine cavity or the amniotic sac surrounding between the fetus. So it prevents the compression and thus preventing the baby for going for distress. It also has got some antibacterial effect which prevents the infection for the fetus. It also has got a nutritional value and thus helps in the normal growth and development of the fetus. And the space as well as the space that it occupies is pretty much essential, and even some of the growth factors for the normal development of the fetal lung, the normal development of the musculoskeletal system as well as the normal development of the gastrointestinal system. These are basically the functions of the amniotic fluid. Coming to the dynamics of amniotic fluid, that means to say how exactly this amniotic fluid is formed and what is the normal amount of amniotic fluid for a various period of gestation. So the amniotic fluid which starts right from 8 weeks of pregnancy, and it will be progressively increasing to reach its maximum level between 30 to 34 weeks and by some authors up till about 36 weeks, beyond which it starts gradually reducing, and then there is a significant drastic reduction in the fluid around the baby beyond 40 weeks and then again the significant reduction beyond 42 weeks of pregnancy. So at around 12 weeks it will be around 50 ml and then reaching to its peak of about 800 ml to 1200 ml by about 30 to 34 weeks of pregnancy, and by about 40 weeks it will be around 400 ml. So is it practically possible for us to exactly quantify this? It is practically not. So there will be various other means when we really quantify amniotic fluid, what we call it as an amniotic fluid volume. So the amniotic fluid volume assessment by ultrasonography is basically done by, you can just imagine maternal abdomen as a 4-quadrant structures, and then in individual each component they will be taking the longest column of amniotic fluid that they are able to see and then add all the quadrants. So the normal amniotic fluid ranges from 5 to 25 centimeter, and anything lesser than 5 is what we call it as an oligohydramnios, and then anything more than 25 is what we call it as a polyhydramnios or the excessive fluid around the baby. Coming to the dynamics of amniotic fluid. So how exactly amniotic fluid is produced and then how exactly it is regulated. So it basically depends on 2 components, the things which add to the amniotic fluid and the second things which basically helps in the clearance of the amniotic fluid. So coming to the things which are helpful in the production of the amniotic fluid, 2 major important things the amniotic fluid consists of is basically fetal urine and the fetal lung secretion. And if it may be funnier to know for all of you that Every one of us, all the babies would have tasted their own urine before they are being born. So thus, fetal urination in fact constitutes the major component of the amniotic fluid, and it is not a constant factor. In fact, when I say the peak amount of amniotic fluid around 30 to 34 weeks of pregnancy as 1000 ml, doesn't mean that it is formed and then it just remains there as a stagnant. In fact, it is surprising to know that the fetus produces about 800 to 1200 ml of urine every day. So the major factors which helps in the normal production of the amniotic fluid are basically, as I told you, fetal urination, which is about 800 to 1200 ml per day. The second other factor is the fetal lung secretion. Again, before the baby is being born, the lung is filled with the fluid, and then this fluid basically accounts for some amount of amniotic fluid. In fact, 30% of the body weight is the quantification of the fetal urine that is being produced every day, and about 170 ml of fetal lung secretions are secreted into the amniotic fluid every day. So they compose, basically, that is the fetal urine as well as the fetal lung secretions are the important component of the amniotic fluid, and to some extent the things that are shed from the baby nasal secretions or the oral secretions constitute a very smaller amount for this amniotic fluid. And what is the important factor that leads to absorption of the amniotic fluid or the clearance of amniotic fluid is basically a fetal swallowing reflexes. That's why when I talk about the oligohydramnios or the reduced amniotic fluid or the polyhydramnios, where I'll be telling you the abnormalities of any of these things lead to either the excessive amniotic fluid or the reduced amniotic fluid. Thus, the production mainly in terms of fetal urination as well as the lung secretion, and the clearance is basically by the fetal swallowing effect, and a very little quantity, what we call it as a transmembranous transfusion, that is the amount of fluid that moves across the amniotic fluid as well as the fetus, right from its umbilical cord or directly from the skin of the baby, also constitute a very smaller quantity for this amount of amniotic fluid, and thus it is being basically regulated by these actions of swallowing as well as the fetal urination, which helps in the maintenance of a normal amniotic fluid on a day-to-day basis. Thank you for watching for all this information. So if you have any queries or otherwise also, I'll be available for consultation at HRBR Motherhood Hospital Monday to Saturday. Thank you.